Hello and welcome. My name is Gregory Jameson. I'm Vice President of Federal Retirement Experts, and I'm so grateful to be here today and talk with you about a very important topic, your federal employee health benefits and how they work for you as you transition into retirement. Of course, one of the biggest questions we get from federal employees is my federal health care transferable into retirement? And the answer is yes. As long as your service and age requirements are met, you're able to carry over your health care into retirement. There are options you have for survivor benefits to, of course, make sure your spouse is on your health care and retirement indefinitely. I have another link that talks about your survivor benefits and how they work for you with your health care. But today we're going to be talking about your federal health benefits and how they relate with Medicare and how they can work together in retirement. So one of the biggest things about your federal health care is that it's highly subsidized. It's one of the best benefits you have. It's about 70% subsidized. Again, one of the best benefits, in my opinion. And your federal health benefits over the last 10 years, one of the biggest concerns federal employees have are the increase in cost of the federal health care. Over the last 10 years, it's been increasing about 8% a year over the last 10 years, a little more. So your health care most likely going forward is going to increase. Hopefully there'll be some type of policy changes or reform that'll help bring costs down. But right now, we're seeing healthcare increase as time goes on. So how do we mitigate the costs with your federal health care in retirement as time goes on? And that may be accomplished through Medicare. So Medicare is an option for you when you reach 65. And Medicare has different parts to it. We have an A, B, C, and D part to Medicare. Now, Medicare Part A is required at 65. So whether you're working or you're retired, when you're 65, there's going to be about a 7-month window around your 65th birthday where you're going to need to enroll in Medicare Part A. Now, Medicare Part A is going to cover just the hospital. So if you need hospital, anything done with the hospital, diagnostics with the hospital, Medicare Part A is going to kick in and cover that. Your government health care is going to be secondary to Medicare Part A at that point. So then we have Medicare Part B. Now, Medicare Part B is not required. It's a choice that you have. So there is a cost to Medicare Part B, and that cost right now in 2023 is $165 roughly. So this is going to be in addition to your government healthcare. One of the biggest questions I get all the time, does the Medicare Part B lower your cost in retirement with the federal healthcare? And the answer is no, unfortunately. So this is going to be an additional payment to your government health care. And the Medicare Part B is going to cover your doctors. It's going to cover preventative services, durable medical equipment. And if you're retired and receiving Social Security, the payment for Medicare is going to be deducted from your Social Security. If you haven't started Social Security yet, then you'll be making a payment directly to Medicare. So Medicare with the Part B requires you to enroll when you're 65 if you're retired. So if you're retired, you're coming up to 65, you have the option to enroll in Medicare Part B. And Medicare Part B has a penalty if we do not take it at 65. So the penalty each year is 10%. So if we delayed taking the Medicare Part B, say until you're 68, there would be 3 years there of penalties at 10%. So at 68, it's going to be 30% higher than it otherwise would have been. So we want to take Medicare Part B at 65 if you're retired. Now, There is an exclusion if you're still working full-time. So if you're still working full-time, you do need to enroll in Medicare Part A at 65 while you're working. But once you retire, whenever that is, it could be 66, 69, you're going to be able to enroll in Medicare Part B and have the option to without a penalty. There's going to be a small window where you'll be able to elect the Part B coverage. So the Part B coverage, what it's going to do, it's going to help to alleviate some of the costs associated with the government healthcare, some of the copays and deductibles. And it's going to help to bring your out-of-pocket costs lower in retirement if you are seeing the doctor for services regularly, and as we get older, having more things done, out-of-pocket costs can be expensive. So having this optional B coverage with Medicare allows you to potentially keep those costs lower as time goes on. Now, Medicare Part C is not required. Medicare Part C, you may have heard of it, called an Advantage plan. The Advantage plans or Medicare Part C for federal employees are not a very popular option. It's an HMO style plan where you need to be enrolled in Medicare Part A and B. Now, with the Medicare type plan, you have a network of doctors that you need to stay in. So there may be limited services with that type of program. Of course, it's working with a professional to help you understand how these benefits affect you into retirement and fine-tune a plan that maximizes your benefits and in retirement, and making sure things are clear and transparent. But then we have Medicare, the last part of Medicare, which is Part D. So Medicare Part D covers prescriptions. And for federal employees that have the federal health care plan, this really isn't required. We have prescriptions covered with your federal health benefits, and there really isn't a need to have another coverage there for prescriptions in most cases. So we have these different parts of Medicare. We have the additional cost of Medicare Part B potentially down the road, in addition to your government health care. And so what we do for federal employees is we put a detailed report together for you, illustrating not just healthcare and how the numbers play out and how they affect your retirement down the road, but we also talk about your group life insurance, your TSP, your pension, and all of your sources of income, and compile them into one report to show you your cash flow in retirement in a simplistic way against your expenses, so we know exactly what retirement's going to look like. We're happy to meet with you and put this report together. We work nationwide with federal employees to help them understand their benefits in a detailed way through this report that we provide at no cost to federal employees. We're here for you to answer all of your questions, to make sure that this important transition into retirement is as clear and transparent as possible. My name's Gregory Jameson, and we look forward to hearing from you. We're always available to you, and we look forward to putting the report that we offer together for you as well.